and welcome to the UCLH Birth Centre. We are based on the 3rd floor of the Elizabeth Garrett Anderson wing, and we are a midwife-led unit that is aimed at women who are enjoying a low-risk pregnancy without complications and go into labour between 37 and 42 weeks. We've created a short video for you to give you an idea of what our facilities look like and to make some introductions of what we do. Now, first of all, you need to know how to get here. There's 2 ways to do that. One is to call us. We have a direct phone number that takes you straight through to the birth centre labour line phone. Now, this phone is carried by the lead midwife in charge of the shift, and you can call this number 24 hours a day with whatever's happening. Ideally, we ask you to call that number when either your waters break, or you are worried about baby's movements, if you notice that you've had any bleeding, or if you think that labour is starting and you're feeling some contractions. We'll be able to guide you what to do over the phone. Quite often it's a good idea to stay at home for a bit longer if labour is starting and everything is going normally, but we will be able to tell you what to do and how is best to move forward. There will come a time when we say to you, great, sounds like it's time to come in and your labour is progressing. So in that case, most of the time we will ask you to come straight up to the birth centre on the 3rd floor. This allows us to look after you directly, assess you on what's happening with your baby, and then we can continue to look after you in labour, so you have hopefully the same midwife looking after you throughout. We'd like to take you around now to see what the rooms look like, so we can show you exactly where you'll be. So this is one of our pool rooms. We have 2 pool rooms on the birth centre, and as you can see we have these lovely big pools that we fill up to a lovely deep depth so that you can really submerge and improve your mobility in labour. Now, hydrotherapy is a really good pain reliever in labour. It's good for relaxation. It's very much like when you feel like you have period pain and you want to get a nice warm bath. So we keep this water at about 37 degrees. The reason for that is that it's obviously very similar to your body temperature. So it allows your heart rate to stay the same, which is good for baby. And also when babies come out, it's a nice smooth transition for them, so they're not going to get too hot or too cold. Water is also great in conjunction with Entonox or gas and air that you might have heard about in our other videos. Now, on the birth centre we have gas and air piped into the walls, as you can see. These are the tubings that attach to this handheld bit, and then there is a mouthpiece that goes onto them as well. So if you decide that's something you would like to use, we will talk you through it and how to use it and coach you through that to help you get the most out of gas and air. The other things that we like to talk about in the birth centre are remaining mobile generally, whether you're going to use the pool or not. So we gear the whole room towards you being able to do that. So the reason that we don't have beds on the birth centre is so that we don't encourage you to go and lie flat on your back, as we know that is not an ideal thing for women to do if they are able to get up and moving. So these couches, they fold into lots of different positions. They have removable bits, and we have bean bags as well to enable you to get into all sorts of positions. We have guides around the room as well as to what positions will work well in labour, but your midwife will also be there to help you understand where's best to be. Generally speaking, your midwife will encourage you to move into whatever position feels right and natural at the time, as your body is usually best at telling you where to be. So we would encourage you to just follow your body's urges. Now, the other things that we can offer, you don't need to bring a ball with you. We have lots of different balls of lots of different sizes, so we'll be able to provide those for you. Those are really good for that early stage of labour where you're just getting into those contractions, as they can help the contractions to come more regularly. And over here is an example of one of our birthing stools as well, and this is really good for slightly later on in labour. It helps the baby's head to get through the pelvis, so sometimes it can really help if your pushing stage is going on for a little bit longer. So there's lots of different things that we can try to help you get through the different stages of labour. One difference with using the birth centre that maybe you might find different to using the labour ward is the way that we monitor your baby. So on the birth centre we'll be using a sonic aid, much like this, that you might have seen in your antenatal clinic appointments, and these enable us to listen to your baby throughout your labour. Now, the reason that this is different to labour ward is that we don't continuously monitor babies on the birth centre, because we know that for healthy women who have well babies and are going into natural labour, that this is perfectly sufficient to safely monitor your baby without over monitoring. So we use these with gel, and we will have a little field to see where your baby is, and then we will direct our auscultations to that area. When you feel like you want to push, or we think you're in the second stage of labour, when your baby's coming down a bit further, we will start to listen between every contraction, and that's to make sure that your baby stays safe in the second stage of labour. These are also waterproof. As you can see, this is a blue head which shows us that it's waterproof. So if you are in the pool, we can use this underneath, so you don't have to move. You can stay mobile in whatever positions you like, and we'll move around you. So we are encouraging you to just go wherever you want to be, and we'll follow the lead. All of our labour rooms and the rooms for after your baby's born all have ensuite bathrooms to help you with your privacy, but also to use as another tool in your labour. So we can now show you what they look like on the inside. We have showers in all of our en-suites to allow you to obviously clean up after you've had your baby, but sometimes showers can be really helpful if you want to stay upright but you're finding the warm water really good and really useful. So we often encourage you to get up and moving into the shower as well. Toilets are a good time to talk about the fact that we want you to keep emptying your bladder when you're in labour. So we'll be asking you regularly, try and have a little wee for us, go and have a sit on the toilet. And this is to make sure that your bladder stays nice and empty to give baby maximum room possible to get through. So to feed that, we also want you to be drinking lots of water, which is another thing we'll be encouraging you to do. So be prepared for that. Once your baby's born, we're going to take you to a different room where we will show you where you're going to be. So one thing that some people worry about with using a midwife-led birth centre is the absence of doctors on the ward. Now we want to reassure you that we risk assess every pregnancy to make sure that you're in the safest place and most appropriate place for you to have your baby, but we also want to reassure you that you are in a safe place if that happens to be the birth centre. So if there are any emergencies that occur in your labour or delivery, and we as midwives identify the need for more hands on deck, whether that be doctors, midwives, anaesthetists, neonatal or baby doctors, then we will pull an emergency bell. Now they look like this on the wall, and they're in every bed space on the birth centre and the labour ward and the postnatal ward as well. When we pull this button, you'll hear a loud flashing noise, and this will go off on the entire floor, which enables people to come to us, and then if needs be we can put out an emergency call so that doctors will come to us as well. This is also one of the resuscitation spots that we can use if babies come out unexpectedly in unexpectedly poor condition, and we have everything here that we need to be able to stabilise babies before we move them down to the neonatal unit. So we just want you to feel reassured that we have everything we need if necessary. So this is a side room on the birth centre. Now all the rooms on the birth centre are fully equipped with everything we need to deliver your baby if necessary, but most of the time, 99% of the time, these are the rooms that we use after your baby's born. So you'd normally stay in the pool room or the other birthing room for a couple of hours after baby's born, and after you've had a feed and you've had a shower and a wee and you've managed to get yourself sorted, and then we bring you into one of these rooms, which is where you would stay until you go home normally. Now we usually expect mums and babies to be with us average of about 24 hours after baby's born. There's a number of checks that we want to do to make sure that you and baby are fit and well, and we want to make sure that you're confident with your feeding, whatever form of feeding that is, before you go home. Babies will stay with you the whole time, so we want babies to be sleeping next to you in the same room for at least 6 months, so we start as we need to go on. And you'll also notice that everything we need for emergencies is in this room as well, but most importantly the call bell is also right there, so the midwives are here to look after you and answer any needs that you or worries that you have as you go forward. There are some occasions where you may need closer monitoring after baby's born, whether that be for you or for baby. So if that's the case and we're expecting to keep you in for a little bit longer, sometimes we recommend moving you over to the postnatal ward where you can be looked after a bit more closely. But otherwise, we normally like to send you home from here.